Oral anti-diabetic drugs. They are classified into three categories. The first category of drugs will enhance insulin secretion. Second, will overcome insulin resistance, that is, they will increase the sensitivity of insulin. And then third is miscellaneous drugs. So three categories. Number one, that will enhance insulin secretion. In that we have KATP channel blockers and DPP4 inhibitors. DPP4 stands for dipeptidyl peptidase 4 inhibitors. So the drugs that enhance insulin secretions are KATP channel blockers or DPP4 inhibitors. In KATP channel blockers, we have two categories: sulfonylureas and meglitinide or phenylalanine analogs. Sulfonylurea example, dolbutamide. Dolbutamide, it is a first generation sulfonylurea. Then glibenclamide, glipizide, glicazide and glimepiride. These are second generation sulfonylurea. In sulfonylurea, we have tolbutamide, which is first generation sulfonylurea. Then glibenclamide, glipizide, glicazide and glimepiride. These second generation sulfonylurea, they will start with the word gli, like glibenclamide, glipizide, glicazide and glimepiride. Then in meglitinide or phenyl analogs, we have repaglinide and natiglinide. Meglitinide, they end with the word glinide. Meglitinide or phenylalanine analogs, they end with the word glinide, like repaglinide and natiglinide. Then DPP4 inhibitors, they end with the word gliptin, like sitagliptin, vildagliptin, saxagliptin, alogliptin and linagliptin. DPP4 inhibitors, they end with the word gliptin, like sitagliptin, vildagliptin, saxagliptin, alogliptin and linagliptin. So the drugs that enhance insulin secretion are KATP channel blockers, which are sulfonylurea, like tolbutamide and glibenclamide, and meglitinide or phenylalanine analogs that end with the word glinide, repaglinide or natiglinide, and DPP4 inhibitors, they end with the word gliptin, sitagliptin, vildagliptin, saxagliptin. Then the drugs that overcome insulin resistance are biguanide and thiazolidinedione. Biguanide, they are AMPK activator. AMPK, it's an enzyme in the liver, they activate AMPK. Example of biguanide, metformin. Thiazolidinedione, it is PPAR gamma activator. Example, pioglitazone. Biguanide example, metformin. Thiazolidinedione example, pioglitazone. Biguanide and thiazolidinedione, these are used to overcome insulin resistance. Then example of miscellaneous drugs: alpha glucosidase inhibitors like acarbose, voglibose and miglitinode. Acarbose, miglitol and voglibose, these are alpha glucosidase inhibitor. Amylin analog like pramlintide. Pramlintide, it's a amylin analog. Dopamine agonist like bromocriptine, and sodium glucose cotransporter 2 inhibitor, that is SGLT2 inhibitor, dopagliflozin. So in miscellaneous drugs, we have alpha glucosidase inhibitors like acarbose, voglibose and miglitol. Amylin analogs like pramlintide, dopamine agonist, bromocriptine, and SGLT2 inhibitor, dopagliflozin.